things that I believe separates Providence from other centers is we don't just hope for the best outcome, we plan for the best outcome for our patients. There are several things I think that separate Providence and set us apart from other centers in Alaska, and it has to do with both the availability of outstanding technology and the personnel and the expertise that we have here at Providence Alaska Medical Center.
You know, one of the last things you want to have interfere with patient care is not having the technology you need to be able to offer things to patients that they need. And we're very fortunate here that we have all the advanced tools and technologies that a radiation oncologist could want to help take care of his patients.
There are several technologies that we have here at Providence Alaska Medical Center that are unique to Alaska. First and foremost is tomotherapy. There is also a stereotactic radiosurgery, respiratory gating, high dose rate and low dose rate brachytherapy, and online portal imaging. These are therapies that we have that are unique to Alaska. What tomotherapy allows us to do is, in an even more precise and an even more conformal manner, deliver our high doses of radiation to the target that we're aiming at. The tomotherapy allows us to image the patient each day right before their treatment. Therefore, we're not aiming based on skin markings or anything else like that. We're actually aiming our radiation based on where the tumor is inside the patient and the target is that day. So in this manner, it is much more precise. We're treating less normal tissues, and yet we're treating the tumors to a higher dose.
In addition to the tomotherapy unit, we have the Varian Trilogy linear accelerator. This is Varian's most advanced, sophisticated linear accelerator. It actually has a CT component to it so that we can help visualize targets on the linear accelerator as well. With that machine, we can also do something that's called respiratory gating. We can follow the respiratory cycle of a patient and only turn the beam on when we are comfortable that we've localized the tumor within the respiratory cycle. In the lungs, tumors move with breathing, and this enables us to minimize the amount of normal lung or other normal tissues that would get treated with conventional IMRT or linear accelerator-based therapies.
One of the other therapies we have here is called high-dose rate brachytherapy. Brachytherapy is implants with radiation, and there's something we call low-dose brachytherapy, where we put seeds or radiation sources into a tumor or around a tumor that may be in there either permanently or for several days. With high-dose rate brachytherapy, we actually have a remote afterloader that puts a very high activity source into a tumor and can move through certain positions in the tumor and deliver a very high dose in a very short period of time. This is very important for both minimizing side effects and actually for increasing patient convenience.
The last thing that you want to have happen for your patients is not be able to offer your patients the treatment you think they need because you're limited by the technology you have on hand.
The Cancer Center here at Providence Alaska Medical Center has technologies that are at least equivalent, if not superior, to the most advanced centers in the lower 48.
There's a whole range of intangibles that most people don't see or consider. The Hickel House is a superb asset. It enables patients to have a home when they're away from home. We also have the navigators, which help them through scheduling appointments and helping them with insurance issues and a whole host of areas. We have our oncology rehab program, where patients who are actually ongoing with their cancer care are getting rehabilitative services so they don't get so deconditioned. That helps these people rebound not only physically but mentally and emotionally as well.
There's a whole team attitude here at Providence, and the patient's care being able to be coordinated between their surgery, their medical oncologist, their radiation oncologist, keeping their primary care physician in the loop, everything put together to help our patients get through their treatment with the least amount of side effect and giving them the greatest chance for cure. I think for most things, there is actually no reason for our patients to have to go outside of the state of Alaska.
Providence is a place that I found everything I needed.
The people at Providence inspired me. I wanted the best care possible, and I found it here.
Providence has the experience and the technology.
I chose Providence, and I'm glad I did.